Hey, that Saharan dust cloud that moved into the coastal bend is triggering the immune systems of so many of you, but the problem doesn't just seem to be the dust. Our Rainer Rodriguez explains.
Coughing and little stuffiness and stuff like that.
Those are just some of the symptoms many are experiencing after being exposed to the Saharan dust, a plume of dust originating in Africa, traveling across the Atlantic and bringing hazy skies to the coastal bend. Also problems for the most vulnerable.
Well, I have allergies and they aggravate I just got over the upper respiratory infection that I had.
Three factors come into play: size, composition, and concentration of the dust particles.
In terms of the size, we know that these are very small particles. So that's easy for these particles to get inhaled into the deeper parts of the lung.
Health experts say the dust by itself is not the problem because this alone is the mineral dust that comes from the Saharan desert. The problem begins as it travels.
There's a lot of microorganisms, such as bacteria, funguses, viruses, and they attach to these dust particles and sand particles.
By the time it makes it to our region, people are inhaling more than just minerals, affecting the elderly, children, and those with underlying diseases such as lung, heart-related, or asthma.
I also have COPD, so I have to watch when I'm outside, especially if I'm working on the lawn or something, with this dust. It probably makes it even worse.
This dust cloud is sticking around for a few more days. In the meantime, health professionals say the best thing to do is to avoid it.
Limit your exposure to the outside, and even if you do, then you should wear a mask. And at that time, usually I try to keep these people on their inhalers or their medications that they usually take, so that way we keep things under control.
Reina Rodriguez, Chris 6 News.